right now. We will be recording this session, and this is really an exciting opportunity. Public engagement is a critical piece of hepatitis control programs, and I think we've seen over the last few years how stories from advocates and people living with hepatitis can be really powerful in terms of increasing hepatitis test uptake, linkage to care, and other outcomes across the hepatitis care continuum. And so this project and this event today is really going to raise up some of these community voices and tell you more about a crowdsourcing movement called We Organize. And so our first speaker is, first we'll have a few introductory remarks from several leaders. First, we'll be hearing from Dr. Meg Doherty. She is the director of the Office of Global HIV, Hepatitis, and STIs at the World Health Organization. And so over to you, Meg.
Thank you very much, Joe. And I'm very, very pleased to be here in the office here, but also to be able to be sharing our thoughts and approaches with all of you online. And it's really an impressive lineup we have here today. And I don't want to take too much time, but this has been a very monumental, I would say, 2 weeks for hepatitis. We're just off the World Health Assembly, which provided us with the mandate under the global health sector strategies, including viral hepatitis, but their global health sector strategies for HIV, viral hepatitis, and STIs, to keep this agenda alive and working towards eliminations for the next 8 years. And that gives us the mandate to work with all of you and to look at innovations and approaches to be able to reach those who need the services. And also, we're just off opening up of the wonderful Third World Hep Summit that happened yesterday, where we heard the voices of our Director General Tedros, from Helen Clark, a former Prime Minister of New Zealand, 2 ministers of health from Egypt and Rwanda, who are sharing the fact that they are committed to ending viral hepatitis by 2030. So again, we've been hearing such positive messages, and certainly we know that we have the tools. We need the political commitment now, but it is within our reach to end both hepatitis C and hepatitis B by 2030. We have 350 million people living with these infections. We have now come out of COVID-19, still working on COVID-19 a bit, but with new science. And certainly the science around virtual innovations have been key. Information, whether it's misinformation, disinformation, infodemic, how to use social media, has certainly raised its profile everywhere. So I think crowdsourcing, getting the voices out, hearing the voices, and understanding what people living with hepatitis have to say is going to get us towards 2030. So thank you for having WHO at this important event. And my colleague Fumi Leshi will be speaking later. And it's important that we raise awareness, access, so that we can have a full response. So back to you, Joe. Thank you.
Thanks, Dr. Doherty. Fantastic. Now we'll hear a few introductory remarks from the World Hepatitis Alliance. Jessica Hicks is the program manager there and one of the architects of the World Hepatitis Summit. Over to you, Jess.
Great, thank you, Joe. And thank you and welcome to everyone today. I'm really delighted to be here on behalf of the World Hepatitis Alliance. The mission of the World Hepatitis Alliance is to harness the power of people living with viral hepatitis to achieve its elimination. And really, that's what this entire crowdsourcing project has been about, and why the Alliance was so delighted when London School of Hygiene and Tropical Medicine asked us to be a part of this project. It's incredibly fitting that this meeting is at the World Hepatitis Summit. The World Hepatitis Summit brings together policymakers, people living with viral hepatitis, civil society, and other stakeholders to really take stock and drive action towards the elimination of viral hepatitis. And I think that's what those of us in the room and those of us online are going to be doing today, really looking at how we can come together to make hepatitis elimination a reality. And at its core, hepatitis elimination really means that we will prevent countless people being infected with hepatitis, and we will save millions of lives. And that's really what's important. So back to you, Joe.
Thanks, Jess. Our next activity is a participatory activity. So for all those in the room and online, I'd like you to go to menti.com. And I promise you won't have to download anything. All you have to do is put this URL on your phone. And for those of you who aren't on Wi-Fi, here, this is the login U1CC public, and the password is 1933. This is all caps UICC, and then there's a star at the end. This will get you into the Wi-Fi. And then the Menti part is www.menti.com. And then once you get there, it'll ask for a code 13506025. So if you can go ahead and use the code and tell us, how are you feeling today? So some excitement, some interest, feeling chilled, feeling calm, feeling energized, feeling hopeful. Great. And I think for the folks in the room, our chat box has been, we've heard lots of introductory hellos. We have a pharmacist from Cameroon online. We have Dr. Ajit Badoria from India. We have Dr. Wei Ming Tang from Guangzhou, China. We have a team from the London School at the MRC unit. And we have Jenny Johnston from SevHap joining in from Melbourne, Australia. So this is our feeling, how people are feeling in the room today. Great. And then our next, just for a moment. So our second question here is, why do you love hepatitis? I mentioned before we have many hepatitis lovers in the room, many liver lovers. What is it about hepatitis that's important, that's compelling? Why hepatitis? Why is this an important issue? And will also be posted up on the Menti site as people enter them. So you can see here, it's preventable. Myself and my sister have been living with hepatitis B since I was 18. Preventable and curable. These are big themes. It's neglected, associated with substantial mortality. It's a global health good, that this is important for global health. It challenges the health system to respond to the lived experience of hepatitis B. It's more than biomedicine. We can eliminate it and make a difference in millions of people's lives. These are just some of the responses. Great, thank you so much. So the next part of this, we're going to have a couple of prepared talks before a panel, and our first speaker is Dr. Don Wu. She's an assistant professor at the London School of Hygiene and Tropical Medicine, and soon to be a professor at Sichuan University in Chengdu, China. She is also the PI on this crowdsourcing project, and she's really excited about public engagement in hepatitis. So I'll turn things over to you, Dr. Wu.
Thanks, Joe. Can you guys hear me okay?
Yes, we can.
Perfect. Thanks, Joe, for really wonderful experiences of public engagement. And when we say public engagement, we really meant that people who are affected by viral hepatitis, who might share similar issues and difficulties in accessing hepatitis services in their own healthcare system, or those who may face the same misunderstanding, stigma, discrimination from their society, or and these people can be invited and engaged to contribute to solving pressing public health problems in hepatitis. And chronic viral hepatitis causes a lot of losses of loved ones and compromised quality of life around the world, especially in African and Asian countries. And for example, China, where I was born and have been surrounded with several loved ones being affected by HBV, has over 90 million people living with chronic HBV infection, accounting for 1/3 of the global infections. And please remember, these are not just code numbers, and each and every one of the individuals could be a powerful story. And it could be one's sister who is infected, pregnant, and worried about transmitting the virus to the baby, not knowing that their vaccine is preventing mother-to-child transmission. And it could be one's brother who is infected and anxious about losing his job every year when the annual health checkup comes, which is required by the employer. And it could be one's parents suffering from liver cirrhosis and its consequent gastric bleeding, but yet not being able to receive treatments in the A&E room, as it might have been crowded by COVID patients. And it could be one's auntie who has gone missing and excluded from all family activities simply because of her yellow skin and people's lack of understanding of the disease. So hepatitis casts a long shadow in many countries. But there is hope. Those who are most affected by hepatitis, they are also most likely the ones devoting their time to help others get treatment. And they are the ones starting nonprofit organizations to provide vaccination, testing, treatment to many more people in the neighborhood. And they are the ones trying everything they can to start a conversation with a local policymaker and getting hepatitis programs and services on the top of the list of priorities. And they are the ones striving to streamline hepatitis services for patients nationwide. So really, they are the ones suffering most from the disease, but in the meantime, bring us hope. And despite all these substantial efforts and wonderful achievements that have been made, there's still a very limited level of visibility of their contributions, and there's much room to further amplify their voices and roles in achieving the goal of eliminating hepatitis by 2030 worldwide. And as a research team, we have found that internationally, much of the published work on advocacy focused on high-income countries and neglecting the significant achievements made by our advocates in developing countries. And I think it's really our responsibility to help empower more advocates from developing countries, including in my motherland, and make their efforts seen and heard by more people internationally. And I appreciate the opportunity of working with the Alliance and their brilliant local partners. And I'm thankful for the support from NHAP, WHA, and WHO to this conversation today. But our project, the Global Open Call, would have never gone so far without our local partners' work that has already been carried out long before our project. So I would like to give my highest gratitude to all those who contributed and generously shared their personal stories to our Global Open Call. And leveraging this opportunity, I hope that this could be a starting point to bring more visibility of what our local partners have been doing and what they have achieved. And of course, there's still much room for improvement, but I'm hopeful that we are heading towards a world where I don't have to worry about my children being affected by viral hepatitis B and C. And now I'd like to give the floor to my colleague, Annie Pokri, who will give you more details about our Global Open Call. Thank you.
Thanks, Anne. That was fantastic. So our next presentation is from Dr. Pokri. She's a postdoctoral fellow at the London School of Hygiene and Tropical Medicine, and she's going to tell us about advocacy in chronic viral hepatitis, thematic findings from a global crowdsourcing open call.
Thanks, Joe. Thanks, Dan. So hi, everyone. So welcome to the online. I'll take the next few minutes to share reviewed some of the advocacy teams we identified from our crowdsourcing open call. So like a brief intro, crowdsourcing has been defined as having a large group solve a problem and then sharing the solutions widely with the public. But the main purpose of our crowdsourcing open call was to solicit stories relating to lived experiences and advocacy with chronic viral hepatitis. We were particularly interested in personal stories or family stories about living with hepatitis and some of the advocacy experiences. In terms of formats, we accepted contributions in images, videos, audio files, infographics, and some written narratives. And for promotion and distribution, we collaborated with the World Hepatitis Alliance and some of its member community-based organizations to sort of disseminate and promote the call widely. At the end of promotion, we received a total of 119 submissions. 85 of these were eligible and they were then screened and reviewed. We had 29 submissions emerge as finalists. So we defined a finalist submission as one that attained a mean score of 7 out of 10, 7 and above. So these are the top ranking, high scoring submissions. And overall, almost half of our participants at 47% had mentioned a lived experience with hepatitis, and cumulatively across all submissions, we had 62% who had either a family or friend lived experience with hepatitis. So pictured to my left, you could see a map. This shows the global engagement and where we received submissions from across the world. So looking at some of the advocacy elements from our submission in terms of numbers, 18 out of 29 finalists had mentioned being a volunteer for a hepatitis-related cause at some point, and 15 community-based organizations across 11 countries had also specified one or more related advocacy activities in their submissions. Overall, across individuals and community-based organizations, we found that they generally turned their lived experiences into advocacy efforts to sort of support and empower others. I've included a very passionate quote from one of our participants in Burundi here, and it says, "I am proud to be one of the hepatitis carriers who helped other patients. I have given everything I have to this noble mission. And every day, my commitment is rekindled with the opportunity to eliminate viral hepatitis." You could feel the passion, you could feel the drive. So in all of this, analyzing submissions, we're able to identify some key areas where these advocacy efforts and activities have mainly targeted. And there's been advocacy for increased awareness on transmission of hepatitis. There's been advocacy efforts towards subsidizing and screening treatment for people within different countries. There's been advocacy for rights for equal work opportunities. So there's been a lot of discrimination around securing job opportunities, also establishing control programs, both at the local levels and regional levels, and very importantly, partnership with the government agencies in hepatitis service delivery. So I'm going to focus a bit more on the last, which is the role of the government. So there's been a lot of campaigns to sort of urge governments to keep their promise towards eliminating hepatitis. I've also included 2 very strong quotes towards advocating for free hepatitis treatment costs. These are from 2 of our participants. The first one is from India, and it says, "It was impossible to start HCV treatment as the cost of treatment was very high during that time." So for hepatitis patients. And then the second quote is an open letter to the government from Benin, and it says, "Dear government, please make hepatitis B screening and vaccination free for all pregnant women." So these are some of the quotes and activities we received in the open call. And so far, after the call, we've been disseminating some of these messages, sharing it widely, and some of our dissemination has been in form of meetings. First of all, we have the top submissions being publicly available and shared openly on the NoHep website, and then we have series of meetings. So we had the pre-holder meeting, which really was zooming on the experiences in the African region and sharing some of these findings with key stakeholders. And then we have a couple of domestic workshops lined up. We've had the Bangladesh domestic workshop, which really shared some of our findings from the Bangladeshi setting and also brought together some key stakeholders and activists. Right now, we're doing also some dissemination here as a side event in the WHS 2022, and we have a domestic meeting also planned for Philippines in the coming weeks. So in terms of next steps, really advocacy efforts should sort of target the key points. We will be reducing stigma and discrimination, increasing knowledge and awareness about hepatitis, and just signposting people to services where available, and then partnerships. Very importantly, there is need for intersectoral partnerships across individuals, CBOs, and the government as well for increased coverage of hepatitis service. And then there is also the need for more research. So social science research projects are still needed to sort of support expansion of hepatitis programs and policies. And then finally, just creating that environment to share stories and connect activities worldwide. I'm going to stop, but before I go, I want to say a very big thank you to everyone who served on the steering committee of this open call, everyone who participated, our volunteer judges, all our partners, the Hepatitis Fund for sponsoring the project, and also really everyone who's joined today, both in person, online. I believe we will continue to do this work in honor of everyone we've known, we've met and loved, and we've lost to hepatitis. Thank you.
Thanks, Dr. Fatima. Speaker will be an open call finalist. This is Chris Munoz, who's from the Yellow Warrior Society in the Philippines. And we decided to pre-record just to make sure that we have good bandwidth. So we will show his presentation right. Can't hear the audio.
Hi, I'm Chris Munoz from the Yellow Warrior Society Philippines, and I'm here to discuss about what we have been doing from the past until the present. So we have been here 10 years in the Philippines, and every year we lobby and hope that the Department of Health would have its own program for the patients, a free hepatitis B and C screening, diagnostic, and treatment. So in 2019, a viral hepatitis technical working group was created by the Department of Health. And together with the WHO, who provided technical support, we found one city to be the role model. So they were given a workshop. And after a few months, the city launched its own project. So right now, together with other cities who has already started its own free testing, diagnostic, and treatment program, there are 3 access points. One is the end referral facility, wherein it's a standalone hospital wherein patients can just go and seek the free testing, diagnostic, and treatment. The other one is like a UHC model, wherein clients can go to the health center or a barangay, a small facility, and if found positive, will be directed to a main laboratory, and if needed, to the end referral facilities. So this model was expanded to those local government units who wants to join the program. The third is the HIV and AIDS core team office. It is a social hygiene clinic wherein patients who already have a prescription may go there and get their medicines for free. So right now we're trying to map out all the facilities and try to establish what are the gaps in the program. And if ever there are problems that the patients encounter in terms of access. So in terms of the legal system, in 2010, we also had a hepatitis B technical working group. And because of Senator Pia, there was a Department of Labor guidelines issuance on the workplace policy and programs on hepatitis B. But of course, employers would still challenge the guidelines because it is not a law and the screening is not prohibited. So we had a case, the first case that won through the court. And then what happened was in 2016, a complainant came to us and wanted our support. And so we helped him file the complaint in November 23, 2016. And after 3 years, the case was decided against the complainant, after which we decided to refile the case and provided more supporting documents. And one of the documents was the Department of Labor issuance. And of course, we also had the advice of the doctors that supported our cause. So in November 26, 2019, the case was decided in favor of the complainant. The case was refiled to determine the lack of compensation and back wage due to him. So in February 27, 2020, the case was settled with improved compensation awarded to the complainant. So what we really want is to have a law that will prohibit hepatitis B and C screening, especially during for employment purposes. So that's all. Thank you very much.
You have a minute or two for questions, and actually Chris is on the line. Is there one or two questions either in person or online, Chris?
Hi, I'm online.
Thanks, Chris. Thanks so much for joining us. I'd be curious to hear more about the case that was settled. Do you think, are there other legal advocacy projects that you're working on now to expand the rights of people living with hepatitis?
Well, actually, before 2016, let's say around 5 or 7 years ago, we already had so many complaints, but because you have to go through the process. So people would normally drop off the case on the first step, because the first step is a mediation process. So you have to go 3 times. So, so people would rather settle with companies rather than go to the process. The one that you saw was the legal, it's on the court already. But before that, you have to go to a process, a mediation process, and it takes time. It will take maximum of 3 months because it has to be rescheduled and refiled. So maybe we have attended more than 100 cases for the first step. And we always say that be sure that you really want to go through the case, and we always say what are the expectations, what will be the expectation and the timeline. So only this person really agreed to not settle and go through the process. Thank you.
Thanks, Chris. And sorry about the poor audio. We have enabled transcription. Our next speaker is Junaid Pecker from the National Liver Foundation of Bangladesh, and he's going to introduce some of the work that they've done in Bangladesh.
Hello, everyone. Before I start, I'm really honored to see Charles here, the founder of the Alliance, and Crowdsourcing, the founder of Liver Foundation, and also people from WHS and Alliance, whom I follow for many years. I'd like to just to give a brief idea about our activities. So what we do in Bangladesh, we start from 1999, and I'm start my job here from 2006. So what we do, first we focus on awareness. So we do awareness in many ways. We do regional hepatitis days, World Hepatitis Day. We have many no-hep volunteers who work throughout the year, different parts of the country. They are very effective students from many universities. Then we have advocacy. What we do that we arrange roundtables and bring some issues to the table so that people can aware about it, and also do some regional programs with the divisions and the district administration so that they can aware about hepatitis and what should they do for the people. And also we do some advocacy for recently we do advocacy for the player from Pakistan who is dropped from the Pakistan team because of hepatitis C, and we shout for him, and it's also shared by him, his Twitter, and many thousands of Pakistanis also shared it Twitter. And finally, it's on the team, so we're happy for that. And then there is testing part. We do testing. We testing in universities and school, colleges, and madrasas everywhere. And recently, we do a Find a Missing Million campaigns in few places. So it is a regular program for us. And then we do vaccination, which is especially for the orphan children. There is every city of the Bangladesh, there is a orphan government children home. So government have to take care of these needs. So we do vaccination for them. We around 8,000 people we already vaccinated for hepatitis B. This is some photos of that. And then we have treatment part. So we have our office in Dhaka. So we treat there in our foundation, and also in COVID time, we use the online platform to support them. Personally, is supporting our initiatives. And then we do some patient workshop where thousands of patients attended with the top hepatologists just will attend and give them the answers of their question, because they have many questions, but the limited of doctors and time, so they use this platform very well. And then we have a Zakat fund. What we do, we help underprivileged people with hepatitis B and C medication and treatment and everything. And this is what. And then how we came here today. So we participated in the No Hep Stories contest, arranged by London and Alliance. We just see the promotion there in the March 2000, and then we thought we'll participate. So we request our Zakat fund members, those who are underprivileged, because there is stigma and discrimination, so nobody wants to share their stories there. So we request them to share their story, but few people are come forward, and we take videos for more than 10 people. And then we finally decide to send these two videos, one from a woman who is suffering hepatitis C, and another from a student who is facing discrimination. So we submit those two videos, and we are lucky that we got one winner of the video. The Muslim Stories got the on the list of the top 10. And then we got a option that hepatitis Hep contest meeting will be held in Bangladesh. So we are happy to arrange it. And this is a very good program, because after COVID, this is the first time we are offline, and it is a hybrid program. And we really learning from crowdsourcing and for hepatitis advocacy and public engagement. So this is some photos of that event. There's participation from many organizations of Bangladesh, and also from the government is there in the program, and also London School and Alliance also present. And there is some media coverage also for it. And finally, what we get actually, digital crowdsourcing can improve hepatitis awareness, testing, reduce stigma discrimination, and will effectively contribute to the hepatitis innovation. So we get a big message from this initiative, and thank you very much.
Thanks, Junaid. I think we have time for one quick question. Any questions from in person or online? Sure.
I have a question. I watched the video before I came over, and it was really moving, the stories from transfusion and the stigma. So I'm just wondering how you're integrating the stigma approaches, reduction of stigma in the community, what's happening now in terms of testing and then encouraging people to come forward and speak openly, because I thought it was a really moving few videos. Thanks.
When you got these videos, and these people are from our Zakat fund, and we have free treatment for them, and she's a survivor of hepatitis C. Now she's very fine. So this is a big message to his community. Just look, I got hepatitis C and now I'm okay. There is no problem of it. So there's no problem. And we have more than 200 patients in the Zakat fund, and they also advocacy for us. They go to their places and talk everyone, say that this is a disease, that we have medicine, we have treatment, nothing to worry about. So you can live as usual. So this is but we can actually, from now on, we can move forward and spread these videos to everyone so that people will be encouraged.
Thanks. And for the next part, we're actually, the videos is a great transition. The next part of the presentation, we'll be looking at 3 different videos from finalists submitted these to open calls. The first one is from Release, a young advocate in the Democratic Republic of Congo. She gave really it's a tremendous submitted a tremendous video, and we'll just play it for you now.
Bonjour, je m'appelle Branlise, membre de la SOGEDEC Enfants. Pour l'avenir sans hépatite, j'ai fait les plaidoyers pour les enfants qui souffrent de l'hépatite. Comme vous le savez, l'hépatite tue beaucoup en RDC, mais les gens l'ignorent. Il n'y a pas de centre pour le dépistage et les traitements coûtent. Pas de vaccin à la naissance. Les traitements coûtent très très cher. C'est l'ONG ASOEDEC qui sensibilise, je disais. Je suis triste de voir une amie SS contaminée par l'hépatite B suite à la transfusion. Nous les enfants, nous disons non à la transmission mère-enfant et par la transfusion. Notre amie ne peut pas attendre d'avoir son traitement. Prévenir l'hépatite maintenant et vacciner les enfants à la naissance. Ainsi, nous demandons au chef de l'État de s'impliquer dans cette lutte contre cette maladie, qu'il donne l'argent à notre club pour sensibiliser nos amis, qu'il donne les médicaments, que tout le monde s'engage dans cette lutte pour sauver les enfants. C'était la voix de votre enfant Branlise. Genève, je vous remercie.
It's an excellent video. The next video is coming from a group in Guangzhou, China. They use digital methods during the COVID lockdown to continue hepatitis advocacy and education. And several of their team members are actually just joining us today online as well. It's the EO Charity Liver Center. So now we'll have a look at this video.
搞错了，再来。今年我们接到的这个求助和投诉比往年增加了2至3倍。这个新冠疫情的影响，有很多的媒体把这个乙肝和新冠病毒进行了混淆，夸大了乙肝的传播途径。很多的学校和这个公司又开始在查乙肝的项目。各样的来自这种社会的一些压力，还有一些偏见，有这些证据的话呢，可以维护你自己的一些权益。那你先加我一个微信吧，然后。
大家好，我是姚媛媛。那在感染610宝宝接种乙肝疫苗是预防。
大家好，我是医委公益的陈爽。 今年我们取得的最大的成就，就是改变了一些体检中心在办健康证的时候还要查乙肝项目的问题。另外，还有一些媒体错误的一些宣传乙肝知识，在我们的努力下，这些媒体都做出了相应的改正。
The final video that we will be looking at is called The Faces of Hepatitis C, and it comes from Argentina. Congrats to the team there at the Asociación Civil Buena Vida.
Hoy es un día muy esperado para todos los integrantes de la Asociación Buena Vida, porque celebramos la cura de varios pacientes de hepatitis C. Nosotros en nuestro grupo decimos que vivir con el virus de hepatitis C es sentir que uno tiene una bomba de tiempo dentro de uno y que no sabe cuándo va a explotar. La cura significa desactivar esa bomba. Por eso estamos todos juntos hoy para festejarlo, entregar las remeras con la inscripción de hepatitis C curado, y ese es el momento cúlmine de nuestra labor como voluntarios de la Asociación Buena Vida.
Soy Raúl y estoy curado.
Soy Majo, estoy curada.
Soy González Julio y estoy curado.
Hola, soy Susana y estoy curada.
Soy José Luis y estoy curado.
Soy Graciela y estoy curada.
Soy Adrián y estoy curado.
Soy Andrés y estoy curado. Hola, soy Miguel y estoy curado.
Hola, soy Gabriel y estoy curado.
Soy Carlos y estoy curado.
Soy Nelly y estoy curada.
Soy Claudio, estoy curado. Soy Rubén y estoy curado.
So I think you get a glimpse of some of these really exciting videos, ideas, and public engagement exercises. The next part is a panel on hepatitis advocacy. Jess is going to chair. I'd suggest we're not going to have a formal break, but if people want to stretch, get up, help yourself to water, please do so. And we'll go ahead and actually, Jess, should we take a couple minutes? What do you think?
Take a couple
5 minutes.
Let people
Why don't we
stretch and then we'll
give people a 5-minute bathroom break and we'll reconvene at 11:25.
Is it
Welcome back. We've had our stretcher break here, and now we'll have a panel on hepatitis advocacy. And over to you, Jess.
Great, thank you, Joe. So really pleased to be joined by quite an exceptional global panel today. So I will quickly introduce everyone before we move on to the questions. So we have with us today Dr. Rita Atugonza from the Ugandan Ministry of Health, Dr. Aninda Raman from the Bangladesh Ministry of Health, Dr. Funmi Leshi from WHO, Nalini Kanta Rajkumar from the Community Network for Empowerment from India, Professor Muhammad Ali from the National Liver Foundation of Bangladesh,
Hello, everybody.
Tasmia Noor Salim, who is the president of the Bangladesh Medical Student Society. And joining us online, we have Vivek Shanmugam, who is the Liver Transplant Society of India. Hello. And Vivek, if you can turn your camera on.
Yes.
Sorry. Perfect. Thank you. Can we? Great. So I have some questions for our panelists, but we will have some time at the end for an audience Q&A. So for those of you online, please do feel free to put your questions in the chat as we go along. And my colleague, Ene, will be managing that, can ask them when we get to it. So I would like to put my first question to you, Kanta. Viral hepatitis causes the loss of thousands of lives every year in India. And so how has CONE helped people living with viral hepatitis within India?
Okay, CONE is one of the drug user organization based in Manipur, India. And all the members here in the CONE are all from the drug users community. So while developing the strategic plan of the organization, we identified improved access to hepatitis C prevention and treatment as one of the key advocacy agenda, based upon the finding of series of consultation held across the state with the involvement of larger PIVOT community, because most of us during that time already affected with hepatitis C. So in 2000, without much knowledge on hepatitis C, in 2012, for the first time in the state, we observed World Hepatitis Day under the theme "It's Closer Than You Think" with the State Health Department and other civil stakeholders. And we advocate government to include hepatitis C treatment under the state health scheme, where people below poverty can be reimbursed up to $2,000 for the treatment of hepatitis C. This was the first achievement of our advocacy activity in 2013. Then in the process of doing advocacy with the government on the issue of hepatitis C, we realized unavailability of hepatitis C data as one of the major challenges. So in 2014, we community-led, hepatitis C testing initiative was taken up in collaboration with government, pharmaceutical company, and research institutions, where we found 49% of people who inject drug tested to be hepatitis C positive. However, the finding was not published in any scientific journal, as we do not have, any IRB approvals. Then in 2015, in new development in the era of hepatitis C treatment evolved in the country with the introductions of sofosbuvir and ribavirin tablet. And in 2016, a fixed dose combination of sofosbuvir daclazavir and sofosbuvir velpatasvir came into the market at the price of $750 for 12-week therapy. So during that point of time, CONE had no other option to help the community. The only option that we had was to approach the pharmaceutical company. Then we started negotiating with the pharmaceutical company for reduction of EAA price. We brought down the price from $750 to $480. That was how we started trying to help local patients living with hepatitis C, especially the drug users community. Then we pursue pharmaceutical company to donate us short expiry drugs. So that is how we started providing, free treatment to 300 people who inject drug, including prison inmates, and also through raising awareness and developing strategy of mobilizing, resources fund. We provide for the first time in 2015 free treatment to 15 widows living with HIV and Hep C co-infection. These widows are all the spouses of the drug users community. This is how we, started trying to end. Also to increase the prescriber base, we organize training for the doctors in the state. And till the national, we continue negotiating a pharmaceutical company, and the price for DAA was brought down from $750 to $160 till the national program rollout in India. So in this entire process, what we observed, what we realized was, a huge gap in the sense of patient follow-up in the hepatitis C care cascade. The number of people tested positive and the number of people undergone RNA tests, and also there was a gap between the number of people confirmed RNA and number of people on treatment. So this helped us to come up with an idea of same-day test and treat among the people who inject drug community. Recently, we developed a model of same-day hepatitis C screening, diagnosis, and treatment among people who inject drug with the financial and technical support from Find and Treat Asia. We cover 523 drug users community, of which 49.5 were tested antibody positive. All these people were undergone RNA tests on the same day, of which 64.5 were confirmed to have chronic infection through RNA tests. 100% treatment linkages were met possible on the same day. So this is how we are trying to help our community through mobilizing resources earlier from the philanthropic organization. But now, after the national program rollout in 2019, we are linking as much as possible drug users community to the national program through organizing, mobile testing camp.
That's incredible. Thank you. Really huge impact and great to see how your work has progressed sort of since you started to today. And this is something you actually touched on really from the beginning, that it sounds like you've really leveraged partnerships throughout your work to achieve sort of what you have. How have you gone about creating those partnerships?
See, that community-led testing model, which we initiated in 2014, fortunately, it was identified as one of the best testing model by WHO during the Innovative Testing Contest in 2016. So I was invited in several conferences to present that model. Fortunately, in 2016, maybe in Durban, I met Collision Plus people, and that was how we started receiving funds related with hepatitis C. So it is because of the testing model, which was identified as one of the best testing model by WHO. That is the opening for us to, start receiving funds for hepatitis C related work.
Oh, that's great. And I think it's great that WHO are here today as well in sort of full circle. Great. So I move on to Professor Ali. So Bangladesh is also disproportionately impacted by viral hepatitis. And Zunaid earlier touched on how the National Liver Foundation, that one of your pillars of work is awareness raising. And so do you want to maybe elaborate a little bit further on some of the awareness raising activities that the National Liver Foundation of Bangladesh has undertaken?
I'd like to thank first the London School of Hygiene and Tropical Medicine for arranging this and inviting us to join this. I'm very much glad and grateful to them. And I'm very happy that I started this National Liver Foundation of Bangladesh for prevention, treatment, education, and research on liver disease in Bangladesh. And with the initiation, because I'm a hepatobiliary and liver transplant surgeon. So while I was doing liver transplants as well as making surgeries on liver, particularly resection of the hepatocellular cancers, I was knowing that most of the diseases are preventable. So while I was working in Australia with Russell Strong in Queensland Liver Transplant Services, back to Bangladesh, I initiated first hepatobiliary surgery in Bangladesh in 1999 and started to organize liver transplant team. And same time, the same year, I started this prevention of liver diseases in Bangladesh, initiated this National Liver Foundation with the permission of the government. And our journey started, and in 2007, we were incorporated with the World Hepatitis Alliance by the invitation of highly beloved Charles Gould. I am very much happy that I am sitting by his side today after so many years. So it's a great day for me. And back to this awareness building, two kinds of awareness models we follow. First thing, we follow the themes of World Hepatitis Alliance. And I remember first theme was MI number 12. And so in 2007, it started this journey, and all theme-based awareness campaign we made, and started this awareness campaigns on the day, which is finally on the World Hepatitis Day was selected, in which I was also one of the signatory to the establishment of, by the invitation of Charles Gould, for getting this World Hepatitis Day established on 28 July. So before that, we are doing this. And after this, when the day was established, first thing we are doing this World Hepatitis Day with the theme, whatever the theme given by the World Hepatitis Alliance. So first we made the programs in the cities, capital city or other cities, awareness campaign, a lot of awareness campaigns. And then after that day, throughout the whole year, we make different innovative programs for reaching the peoples, particularly in the rural areas, because in our country, more than 60% people are in the rural areas. So making a program, and particularly one-day program in a city, and I believe that 60% is not getting any message. So we made some innovative programs, initiatives to reach this mass people in the rural Bangladesh, that is the unreachable community, and they are the grassroots population residing in the villages. And I visited most of the districts of Bangladesh, about 64 districts I visited, and asked the peoples, then do you know what is hepatitis B? Do you know what is hepatitis C? They don't know. Most of the answer is no. I think say 90% told no. Someone's told, I heard about jaundice, but what you are telling, we don't know. So this is the scenario which I got. And after getting this scenario, I was more emphasized than how to reach these peoples. So first thing I started doing regional hepatitis days. Okay, 28 July is over. Then link up with the government administration of a district administration, and we'll observe a day. With the name of the day will be according to the name of the district. Suppose Khulna Hepatitis Day, Chittagong Hepatitis Day. According to this, we'll go there. We'll all these campaigns, awareness rally, free screening, vaccination. So with the support of the local district administration, divisional MK, and then local parliamentarian, and then schools and colleges, one day-long program. And same time, we made free screening and vaccination of the orphan children there. So most of the areas, most of the districts we have covered by this time, by this regional hepatitis days. This time, due to COVID, it was stopped. Now again, when the COVID was going down, we started again. Another thing we made this patient conferences. We call the patients, hepatitis B and C patients, in a conference room and tell them to come with your family as well. And on the dais, sitting the renowned hepatologists and those treating doctors treating them, because they don't get the close contact them. We get very much highly interested, these pupils. We could not accommodate in this. If there are 400, 500, 600, it is full. And they started coming before the hall is open. And when the time is up, they don't like to go. And they have got a lot of things to know. They have got a lot of things to ask their doctor. So it creates a highly impressive things. And yes, my message is going right way. And he's going to be aware, his family is going to be aware. So we made a lot of patients conferences in different cities then we made a youth communities, we called, and make a NOHEP network in Bangladesh, making them member. Then you people go to the people and take my message, this brochure, or now we pass the text message and tell the people about hepatitis B and C, so that the common people in the village area, remote area, they can engage it. We made apps in Bangla about hepatitis B, no hepatitis, and stay well. And so apps is there. And then we took the help of the cricket. That is, we made the name is NOHEP cricket. The cricket is very popular game in Bangladesh. So we took the that is the cricket players and the cricket followers. And Zunaid is one of the president of the cricket's associations, lovers association. We took the initiative with them, and I'd like to pass the message of the cricket, because a renowned cricket player, if say something, then do this for hepatitis, don't do this hepatitis, is a very good thing. And then we took the help of this finally medical students, as Tasnia is here, about 2 years ago. We engaged them because this medical student group has got the network throughout the country. So if president of a medical student society, and if they say something, it will be easily conveyed to the medical students, and they are working very well. That is, whatever we say and pass this message, immediately it goes to this. Within a few minutes, it is going to the whole nation. So this is, I think, we are making awareness building like this. Another thing, when the last issue of prevention of mother-to-child came, and then we think that what is my thought is that, and that is the hepatitis B passes, that is the pregnant women, and the caregivers, the obstetricians and gynecologists. Because if gynecologists and obstetricians taking care of this pregnant lady who has got the hepatitis B, and if gynecologists don't open the mouth, don't say anything, she is advising her, he is advising a lot of things. Do this, yes, do the test, CBC, blood count, this. But if he or she does not tell about hepatitis testing, rapid test of hepatitis B, and you imagine that easily this hepatitis will be passed from mother to child in her hand, and nobody knows. Maybe 2-3 deliveries she is conducting for one woman, 2-3 children is gonna, and everybody is going in her hand. So I took first initiative to call the Society of Gynecology, president, secretary, vice president, and renowned gynecologist of the Bangladesh, and to pass the message of this is the mother-to-child transmission, in which this medical student society was involved. And then you people must have to tell one word. Your one word can save 2 lives. I tweeted also that mother and the child, mother can get treatment and the child get vaccinated. So your one word can save 2 lives. That was my tweet also, and I got a very good reaction. Another thing I did for PMTCT, we have got a lot of women organizations. So we took the help, make the webinar at that time with a lot of women organizations. And I told them, this is the scenario these women are suffering and passing hepatitis B from into their child. So you peoples are working with the women health. You take the initiative and make one test for me, and that is a rapid test for Hep B. And this test will save this everything.
That's great.
Yeah.
I think just with time, we might have to move on, but the amount of work that the National Liver Foundation of Bangladesh does is truly incredible. And I know that the Alliance, you're a great supporter of all our campaigns, and we're always blown away by the incredible work that you're doing. And I think we could all listen all day to everything that you're doing, but I know that we're constrained with time. So I think we might have to move to the next question, but thank you so much, Professor Ali. You know, it is really, truly inspiring to hear the work that you've been doing in Bangladesh. So if I move now to Funmi, so we've really heard the incredible impact that community organizations can have on the ground from Cancer and Professor Ali. And in the global health sector strategy, there is really a strong emphasis on community involvement. The new strategy that Meg mentioned went through the assembly just sort of 10 days ago now. So from sort of the WHO perspective, can you tell us why communities are important and why the new GHSS has really emphasized this point?
You see,
sorry, that was for me, sorry.
Thank you very much. And I think I would start by thanking the London School and the Hepatitis Fund for this signing team. And we commend the exciting work they're doing. I would like to make 3 quick points and maybe ask a question. And I think the first point is to say that hepatitis elimination would not occur by 2030 without the support of the community. Now, why do I say this? We all know that the 2021 report tells us that 10% of over nearly 300 million people are aware of the hepatitis B status, and 21% of the hepatitis C community of nearly 58 million are aware. There's a huge gap in awareness. The 2020 target was 30%. We didn't make that target. The 2025 target for awareness is 60%. And the 2030 target for awareness is 90%. So if we don't change our strategy, communicating with the communities, we are not going to make those targets. So there's a huge gap. And our strategy is about elimination by 2030. So crowdsourcing looks like an exciting opportunity to reach this target. It's really an innovation. Now, the second part is the new GHSS you mentioned that has an entire strategic direction of community engagement. The previous strategy did not have this. It was part of the strategy 1. Now, this new approach to engage communities is really one of the strategic shifts in the new strategy, and it's from the lessons learned from the COVID-19 response was an eye-opener of the need for communities to be involved in the response. It's also been part of the consultation that went into the development of the strategy, because we got feedback from huge communities, from civil societies, from governments. So going forward, working with communities and civil society is very important. So the role of WHO is not just to make policies, but one of the things we're doing is ensuring that these policies to involve community are going into the regional plans, the national strategic plans. Communities are now at the table in technical working groups. That is one of the policy effects from our current strategy. Additionally, partnerships, very important. Partnership with World Hepatitis Alliance has brought us to this table right now. And that accounts for London, Brazil, and currently the World Hepatitis Summit that is holding now. So partnerships, coordination, bringing people to the table, very important. And technical support to partners, to communities, to governments, very important in promoting the role of community and a down grassroots movement up to policy level. I'd like to ask one question, and that is, how do we adopt and adapt some of these methodologies to reach the less
urban population. We're talking about in communities where and countries with high hepatitis B and C prevalence, half the community lives in the rural areas. So they may not have access to such digital technologies. Prof has mentioned some of that, but I guess we need to think of how to adapt some of the methodology to reach those people, and then the ethical considerations in the various approaches and steps in crowdsourcing. So thank you for the opportunity to have this conversation and to be part of this thing. Thank you.
Thank you.
Great.
A really important point around rural communities, and it's something that we've seen through some of our other projects with members, where we've gone really the importance of adapting into local dialects, local languages, making sure that people can understand the information, that, you know, really working within those communities. And I'm sure that people around this table can speak to that more than I can, and hopefully we'll have time to discuss that a bit further during the Q&A. But I think on the role of partnerships, a really important partnership is the one with governments. And so Dr. Ashugonza, if you could tell us, what is the role of government and the public sector in establishing new hepatitis services and innovations?
Thank you very much, first of all, for the opportunity to attend this panel, learn, and also the opportunity to share. Maybe just to emphasize that even in Uganda, which is one of the emerging champions, where we have high political support, academia, research, and advocacy, especially organizations with people with lived experience, have been very, very key in getting us where we are today. So the role of government is to listen to its people, and to listen to its people and to listen to the experts, look at the context, and then start to put in place policies, strategies, and guidelines that will help us get to where we need to get, in this case, elimination. I'm happy to say that for the past 5 years, we're in the process of developing our current national strategic plan for hepatitis. The difference with this plan is that it's going to be costed. And usually when you cost a plan, you're able to mobilize resources, both domestically and also externally, and then begin to implement, especially now with the different pillars that have been identified by the WHO. Governance is very, very important. We're in a resource-limited setting, and that also includes human resources for health, and also ensuring that the services are as close as possible to the people who need them the most. Lacey has just been emphasizing that the community is where the problem is. And as we speak now, for most of our cascade of care, it's still at the higher levels of the health facilities. So I think we're watching very closely, waiting to hear from WHO how we can actually effectively find ways to simplify diagnostics and ensure that we're able to put people in care without minimal tests. I was very impressed with the 7-day test and start treatment in India. You know, that's what we need to get to in our countries. And ensuring we have the supplies we need in country, test kits, so that we can actually identify those who are positive, and then treatment, which is very, very key. We're able to manufacture the drugs for hepatitis B locally within country, and that has been very key in getting people onto treatment for hepatitis B at DAAs. You know, I'm listening to the costs, and you know that's something now we need to start negotiating for, as well as as a country. And then, of course, people-centered care. You know, every one of us, I think, has been in touch with the health facility, and we want to go to a place that's welcoming, you know, where we feel comfortable and we actually get quality services. So there's a very, very big push across the sector to now begin to improve our quality of care indicators. And of course, that cuts down to our patients who are living with hepatitis as well. So it's not a small task, because you have to look at the entire health system for our patients, but I think we're in the right direction.
Great, thank you. And really great to hear about what Uganda is planning. And we actually have an incredibly strong advocate there, a member of ours who I'm sure has been very involved in the response. Kenneth, yes.
The National Organization for People Living with Hepatitis has been very, very key in getting us to where we are now.
Great
experience, yeah.
And you touched on some really important points around sort of the costing and the financing and also just the health system in general. And so I want to ask you, Dr. Rahman, how can hepatitis services be included within the broader movement towards universal health coverage?
Thank you. Thank you for the question. And first of all, thanks to the organizer for this wonderful session, wonderful side event, and thanks for inviting me. So regarding your question, I think we all agree that getting these hepatitis services into the universal health coverage is very important. Otherwise, we won't be able to achieve the hepatitis agenda. I think we all agree. But to answer your question, I think we already discussed lots of things like related to this. And for last 2 days, like whenever we are discussing something about DAs, diagnostics, I think these issues came up in lots of discussion. So obviously, it's very important to engage the policymakers, right? Like to make approval from them. But to get that, obviously, I think everyone will agree that we have to engage the community as well. We have to generate demand from the communities, right? Otherwise, it's not like, actually, when we are talking like yesterday about like keeping the cost of the DAs down, like just my previous speaker said, we have to also generate demand, right? Like the cost of our DAs in Bangladesh is still about $1,000. And it's in the same position from 2015 when we started producing these drugs. And when we are trying to find out the reason, one of the reasons came out is there's less demand for the drug. So less demand from the patient, also from the community. So yeah, we saw a very beautiful video from Congo, right? And those kind of demand from the community is also very important if we have to include the hepatitis service in the universal health coverage. And also, I think information is another aspect. We have to generate quality evidences that this kind of investment actually works. Like otherwise, why policymakers will give us the fund? So we'll have to make some compelling evidence that like what are the disease burden and what kind of benefits we'll get from that. Actually, from our program, national program, we're actually trying to do that. We are giving fund to some, like normally we don't give research fund, but this year we have started giving research fund to some project that includes generating evidence for hepatitis control. So with those kind of evidences, probably we'll be able to engage our authority in making decisions. And yeah, I think these aspects are important. And also, I think we have to, other factors need to be considered, like strengthening the health system. Like if you're trying to incorporate those drugs in the universal health coverage, before that you have to prepare your health centers to provide that services, right? Like we are doing that. Like last 3-4 years, we have already trained about 20,000 doctors and nurses on hepatitis. So we are trying to build up our health system first, and we are trying to now generate more evidences. We are trying to expand our diagnostic services. But yeah, our logical next step is to incorporate those DAs into our national program. So we are already giving some DAs, but like it's a very less amount, so we want to expand that. Yeah, I think I answered the questions. I mean, there's no time, so
Great, thank you very much. And yes, I certainly hope that you are able to bring the price of those DAs down and definitely incorporate them into your health system. And so moving on, we heard earlier about the importance of intersectoral partnerships. And Vivek, your father received a liver transplant because of hepatitis, and you are now not only a passionate advocate for hepatitis elimination, but you're also a liver transplant surgeon. So can you tell us how your personal experience really contributed to you becoming a hepatitis advocate?
Yeah, is it still good morning there? So, yeah, good morning, good afternoon, good evening from wherever we are. Thanks for the opportunity, Joe, Jess, Dan, and the Alliance for this lovely meeting. Obviously, it would have been better if I was there too, but I'm just sitting on the other side. But anyway, the story is that my father, who's a surgeon himself, a gastrointestinal surgeon, contracted hepatitis B when he was operating on someone with chronic Hep B. He didn't realize until when he himself had gone to donate blood for another patient. And they said that he's had Hep B. And this was in the early 1990s when India did not have any antivirals at all. And of course, subsequently interferons came and then lamivudine came. So he tried all of that and then he developed resistance to the drugs. And of course, I was working in the United Kingdom then. So I took him there and then we met up with a virologist by name David Munoz, who was a leading Hep B specialist then. And he suggested combination of drugs and somehow we got the virus under control. But because me being a transplant surgeon, me being trained in liver medicine, I was able to follow him up very closely. And then subsequently, I knew things can decompensate. So once he decompensated, he developed a small tumor in his liver because I used to screen him with ultrasounds and alpha fetoprotein ever so frequently as per guidelines, of course. And once this was detected, I was able to transplant him. And touch wood, it's 9 years since transplant. He is so active, and because we did a transplant when he was 68, and we put a 40-year-old liver into him, and now he says, I'm 49 years old now. So but he is I'm sure you know him very well. He's ever so active. But what struck me was that I had the ability and the facility to detect these complications early, and not many has got this facility. They are not lucky enough, and I realized how apt is that prevention is always better than cure. Since then, we at Chennai Liver Foundation, obviously, which was formed in 1998 by my father himself, we've been quite aggressive and strongly advocating in early screening and vaccination against hepatitis B. We've done a fair bit of work. We published our work. We're coming to close to 200 camps in the last 5 years alone. We've screened close to 45,000 people, or close to 10,000 people have been vaccinated in the last 5-6 years alone, which after I've taken over and kind of formalized the whole thing. I think there is no doubt that the patient, the family voices are far heard than professionals, because it's easy for the family to bring out the emotions and the connect with the community. I think when a doctor comes on and says, all of you get screened, all of you get vaccinated, it's difficult for them to understand. But when the emotions come out, like the movies which we've just seen today, I think the connect is far better. Unfortunately or fortunately, I think I've been on both sides. I've been on a patient side, listening to David Munoz and others as to treatment for hepatitis B, and I've been on the other side of the table managing these patients. And when these patients tell me the story, it's so easy for me to connect and react very, very quickly. And that is why I believe that patients and their families should be in some form of leadership role to drive elimination, to drive this program forward and eliminate by 2030. Civil societies and patients with lived experience should be working together with the government and stakeholders for an effective elimination program. But unfortunately, not many countries have this kind of an arrangement. Patients are still patients, doctors are doctors, civil societies are civil societies. They don't come together in many places. And that is why we are still slightly so. And I have to say, in India, I think that is very true, because India is a huge country. I mean, maybe Tripura is doing fantastic work. Punjab has done some work. We know all that. We've done our work also How and why? Because we are doctors and we have the connect with the government. But lots of other states in India do not have that connect. I think that is important. I think why patients need to be included in this program is that I think the day-to-day problems, the difficulties they are taken into consideration, and when the policies are made, it's very practical and easy for implementation. I think one advantage which I had was that, of course, we advocate very strongly. I think we've done enough of camps across the community. We work with the government, we work with corporates. We're doing various kinds of activities. We are in advocacy. We teach the doctors. We are into we're kind of setting up an online program for teaching, doing various kinds of activities. We identify patients at risk, screen them, offer them treatment also. And today I have the ability and facility to do a transplant if it's required, or even a liver cancer surgery if it is required. That linkage of care is important, and that is why patients with lived experience should be working with other civil societies and professionals so that the linkage of care is achieved and thereby eliminating this disease. I think to sum it up, patients and families with this experience should be encouraged to come forward. The government should encourage them, and only then this hepatitis can be eliminated by the year 2030. Thank you very much, Jess.
Thanks, Vivek, and I really couldn't agree with you more. Though I do think that we need more medical professional champions and advocates like yourself as well. So thank you for everything that you're doing. And so moving to our final panelist for today, who is another medical professional and sort of the next generation of champions. So as president of the Bangladesh Medical Student Society, you've been really engaged in hepatitis advocacy within Bangladesh. So can you share what motivated you to become an advocate for viral hepatitis?
Thanks for that question. And I would like to take this opportunity to thank the World Hepatitis Alliance and the London School of Tropical Medicine and Hygiene for this opportunity. And it's an honor for me to be amongst such distinguished panelists today. I'm really inspired for the last 2 days to be amongst you all. To answer your question, well, what motivated me, I would like you and everyone else here to picture a scenario with me. So it's the year 2018, and I'm a third-year medical student. So I'm just beginning my clinical classes, and I enter a ward full of patients who were asked to take the history of one of them. So it's my first history taking. So I look at a patient who has the friendliest face on the ward. So I'm just going to go to him, and someone next to me says, "Not that one," and points to like a writing on the wall over his bed. And it says in big red painted letters, hepatitis B positive. So I'm telling you this, and I was really confused because I had already learned all about hepatitis by my third year. And I was confused how just talking to this friendly face could get me hepatitis. So what I'm trying to highlight here is the stigma that is associated with hepatitis where I live, and which motivated me to become an advocate for it. And what prepared me to notice and care for these existing discrepancies and discrimination in the society where I live is my involvement in Bangladesh Medical Student Society from my very first year since 2016. If I hadn't been involved, I wouldn't have learned to see these things that happen around me that shouldn't happen. The Bangladesh Medical Student Society, in short, is a non-profit voluntary organization of medical students in Bangladesh. We're the national member organization of IFMSA, the International Federation of Medical Students Association, which is one of the largest and oldest student-run organizations representing a medical network of 1.3 million medical students around the world. So like IFMSA, we work over 6 pillars. So one of them is the Standing Committee of Public Health. So the Standing Committee of Public Health brings together medical students to explore and share their ideas, discuss public health problems, and come up and brainstorm solutions to these existing problems. And one of the key focus areas of SCOP, in short for Standing Committee of Public Health, is communicable diseases. And amongst communicable diseases, hepatitis has always been one of the national priorities in BMSs, and we've always worked towards the awareness. Because as medical students, we know that awareness is what we can do because we haven't learned to treat yet. So hepatitis advocacy has for the longest time been listed in our national priorities, but it is worthwhile to mention that ever since the pandemic began, our efforts increased because the pandemic made us realize how great the role of spreading awareness is, right? If you think about it, most of the world has surely written about something or the other about COVID prevention on their social media. Not us, we're all dedicated to hepatitis advocacy here, but we're talking about the general public. But really, how many people in the world have spoken about hepatitis prevention in their social media? So our national team from the Standing Committee of Public Health recognizes growing need during the pandemic of instilling self-awareness about hepatitis among citizens in Bangladesh. And we launched an intensive hepatitis awareness campaign entitled Mission Hepatitis Free Future. It was inclusive of screening workshops, webinars where we invited hepatologists to speak about hepatitis and spread awareness and answer questions of the general public. So for every project or goal, we do need initiative, which we took. But the second, even more important aspect, I believe, is sustainability, to make any project work. So this is when I want to applaud the National Liver Foundation of Bangladesh. So when we approached Professor Dr. Muhammad Ali, who's amongst us here today, the founder and first liver transplant surgeon of Bangladesh, actually, he welcomed our advocacy efforts with open arms. And that is why for the last few years, we've been able to sustain our efforts in increasing youth engagement towards the elimination of hepatitis in Bangladesh. So during the opening ceremony of the summit, I heard that there are over 300 member organizations of the World Hepatitis Alliance. And I was thinking, if every member organization of the World Hepatitis Alliance, like NLF, supported their youth of their respective country, imagine the youth workforce we would have today. Maybe it wouldn't just be me in this room. Maybe I'd have a couple of friends here. So this is a point that I really want to address here. Yes, youth organizations, they have a lot of energy and a lot of drive to achieve things. But in cases we lack the experience and logistical support needed to maximize our potential. That is why we need the collaborative support of experts in the field to help us. With the appreciation that BMS has received from nationally and globally recognized organizations like the National Liver Foundation and the World Hepatitis Alliance will be the fuel that keeps driving our motivation to continue our efforts in public health advocacy.
Great, thank you. Asmir is actually chairing a session at the summit later this afternoon on Youth Can't Wait. And so I would really encourage you all to attend, because I think building a greater youth movement advocating for hepatitis is really important if we're to reach elimination. And we're very lucky to have Tasmir leading us on that. So I know that we are running a little bit late, but I will hand over to Annie, see if we have had any questions from the audience and if anyone in the room has any questions before we wrap up.
Thanks to all unfortunately, we're over time. We do have some questions, but we would like to give each of the 30 seconds to just do a cut summary. We'll go around for contact.
Concluding remark, you mean?
Just 30 seconds, yeah.
Or 30 seconds. See, to achieve the underlying principle of sustainable development goal, that is leaving no one behind. If we really want no one to leave behind, then it's high time now to support community group or the local organization, both with the financial and technical resources.
It's my turn, I guess. Yeah, like as Meg said, like lots of people are unaware of hepatitis, and it's in Bangladesh, the situation is more dire. So I think this kind of advocacy, community engagement will really help us reaching the hepatitis agenda. And I really hope that this kind of activities gain momentum in Bangladesh. Thank you.
Right, so to summarize, I'd just like to say that I was trying to talk about creating a domino effect. Like if I have to give an example, we had an event where the NLF supported us in hosting a screening workshops for 20 medical students during the pandemic. So it was a small scale one, and they were required to go back to the respective districts and host more there. So what we tried to create is a domino effect. And that's what I'm trying to talk about here, that the youth has huge underappreciated potential that we must begin to use. And I'd like to close by saying that we need to appreciate the impact that effective mobilization of youth can bring. and continue to expect meaningful youth engagement and multidisciplinary unity at all levels of health system policy processes towards the elimination of viral hepatitis.
I think I'll take 10 seconds. Okay, so thank you first of all for this opportunity. It's been a great 3 days for some of us. I think my take home from this is that elimination is possible. Charles talked about the older siblings who are well off yesterday, but I think we need to learn from them. You know, we've been in the shadow, but some of them have achieved epidemic control, and it's time to take advantage and draw from those lessons learned, especially in this situation where our resources are a bit limited. We need to leverage on other programs as well. So elimination is possible, and we're working towards it, and the future is bright for us.
Thank you very much. I think one theme I've heard from every speaker is a question: where are the people? Where are the people with viral hepatitis? Where are those 300 million people? The government of Uganda is asking that the people move the government. So people are the fuel to action. And I know that in the past 15 years, we've come so far. How can we expand and accelerate by 100% in the next 5 years? It would be great to have a plan. And just to add to that, WHO's theme for World Hepatitis Day that is coming up is bringing hepatitis care closer to communities. Yesterday, we had the upcoming guidelines of decentralization, task shifting. So we are creating the services. Where is the demand? And I just want to add that in one of the countries, drugs were imported into the country and they expired because there was no demand. So we have an equation without the people. We need the people, and we give you the charge to bring the people to the table to work together for hepatitis elimination by 2030. Thank you.
My turn. Thank you, Jesse. Yeah, I will tell only one word. That is the advocacy and advocacy and advocacy. And second word is second only word is the action. And our advocacy should be first to the government, that to come to the definitive strategy for control of viral hepatitis in that nation. And second thing should be the groups, that is the stakeholders and those who are affiliated dealing with the viral hepatitis, they should come together. We should make advocacy to them, that you come together, raise the voice together, so that the message, a concrete message, pass to the common people. And finally, third advocacy to the common people, and also that is the grassroots activation. That I told that a grassroots activation is the base of the elimination pyramid. Thank you, everybody.
Thanks. And Vivek, do you have a quick 30 seconds if you'd like to chime in before Charles gives his final remarks?
Yeah, can you hear me?
Yes, we can.
Yeah. So I don't know Charles was there. Sorry, my father would have said hello to Charles, so I'll say hi to Charles. So I did that 10 seconds of that. So I think one thing which maybe the Alliance should be doing is that I think in the very first summit, I think over 170, 180 countries signed a declaration. I think the Alliance should write to all these countries who have signed the declaration, say, what have you done and what is the progress that's been made, and what help would you need from the Alliance or the WHO to fulfill that commitment of elimination by 2030. That is extremely important, because I think what I've seen in the last 7 to 10 years is that I think multiple sparks are coming out, but nothing's coalescing together. We're not joining together. I mean, in countries as big as India, there are lots of multiple people working, but everyone's working in a scattered way. The government is working in a different way. I think the Alliance should put all these things together and ask the heads of the countries as to what is happening. You have signed a declaration. You're responsible for it. Please give us an answer. Thank you.
Thanks for that. And now our final closing words. Charles, we started with you, or we heard yesterday about 15 years and the reminiscing, and it was really I think an amazing journey. The story of founding the World Hepatitis Alliance, of pushing forward these issues in such a powerful way. We're delighted to have you join us today and give a few final remarks. So over to you, Charles.
Thank you, Joe, and thank you to everyone who contributed. This has been a really fantastic session, full of really good comments, very moving points of view, and indeed this whole project has been great. So congratulations to you, the London School, World Hepatitis Alliance, for putting it together. And with one of my hats on as a director of the Hepatitis Fund, we're delighted to have funded this. And I think that part of what the Hepatitis Fund tries to do is to really catalyze things. And this project is intended to do this. It's not about, well, here's a project, that's it. This is about lighting a spark, trying to do more in crowdsourcing, in the use of social media, in trying to build this community that needs to demand action. You know, I think we've heard it from all of you. We've got to do this, whether it's youth, whether it's a 9-year-old girl asking the president to do something. This is what it's about, but we don't yet really have the numbers. As Fumi said, where are the 350 million people? We need to engage them, or at least we need to engage a significant proportion, enough that will really push governments, because at the end of the day, it's governments who actually are going to have to invest in hepatitis. And as we've heard, it's an incredibly good investment, but you need that advocacy, because turning what's a really good investment into a political priority, that's what's required, the advocacy. It's not just because it's a really good buy, as we heard yesterday, that is enough to push governments to do something. So, and I just want to make one comment. I'm appalled to hear that DAs cost $1,000. This is unacceptable. The Medicines Patent Pool has licenses from the companies that our generic manufacturers can then produce. The Hep C DAAs, frankly, should be under $100. Actually, they should be under $50 for soft act. But again, it's this thing about demand. We've got to demand, and governments need to think about pool procurement and other mechanisms. But really, we need the people who need those medicines to come forward and ask for them. So once again, thank you very much for organizing this, a really great workshop or side meeting or whatever. All of your participations were just so really on the spot. It's great to hear from you all. Thank you.
Thanks. And thanks again to the Hepatitis Fund, to Anae, Fakri, to Don Wu, to all of our panelists, to the World Hepatitis Alliance, and Jess and Cynthia and Katka. It was really a team effort, and I think we have recorded this section. We'll certainly put the archived version online. And thanks again to everyone. Hope the rest of your summit is productive. Thanks.
Thanks. And thanks everyone for joining online.
Great job.
Happy to still meet.